What's up, guys? Welcome to episode 77 of the Unofficial NCLEX Podcast. My name is Katie Kleber, and I am your host. And today we're going to talk about this episode, which is called Evaluate Whether Aseptic Technique is Performed Correctly. So aseptic technique, another way of saying sterile technique. And I talked a little bit about it in the last, actually in episode 75, about sterile technique. And practically, you as a bedside nurse, the most frequent thing that you're going to do in sterile technique is insert a Foley catheter or clean a central line. But it's important to know whether or not sterile technique or aseptic technique was performed correctly. And actually, I put a link in, and I'm going to talk a little bit about it here, in the PDF of Common Breaks in Sterile Techniques. And it was actually published by the AORN, American Operating Room Nurses, I believe, their journal. And I wanted to outline some of the very common things that are common breaks in sterile technique that you, as either the person performing this procedure or the person kind of helping. And ideally, if you're ever doing something sterile, you have another person in the room that's clean, that can grab things for you, or position the patient, or just observe to make sure you're doing it appropriately. Because I actually have done this before, where I'm doing a sterile procedure and someone's helping me, and they notice, a patient moved their arm when I had turned my head, or I accidentally dropped something and I didn't even notice it. So really, I think the cornerstone of this is having someone else with you, another set of eyes. But let's talk about common breaks. So one of the most common, not noticing compromised packaging or not noticing moisture on the inside of packaging. That makes it no longer sterile. Another very common one is an unsterile person touching the sterile field. So that could be the patient unexpectedly moving, or moving purposefully, or maybe the person helping you accidentally forgets and they touch something in the sterile field, trying to be helpful, but then it's like, great, or maybe, because maybe someone opened something and dropped it on the sterile field for you, and yes, that is sterile, but maybe they accidentally dropped the packaging, and the packaging is not sterile, and that gets on the field. Or just a big one is just not watching out for each other and letting each other know when something was compromised or almost compromised. So it's really important to, again, making sure you're observing yourself, and then really helpful to have another set of eyes, checking it out. So, again, like I said previously, you're going to see this a lot more in the OR setting than you are on the floor. And most likely, if you're helping with I've helped with sterile procedures like inserting an extraventricular drain. So, where they drill into the skull and they put a drain straight into the brain. I've helped with that procedure. I've helped physicians insert central lines. I'm not doing it at all, but I'm kind of their clean person helping, and dropping various things on the field if they need it or whatnot. So it's very different than you constantly doing all of these sterile things, which I feel like is not very, very common. So it's important to be able to know whether or not you're doing it correctly. And when you get into the hospital and you get into your job, check out your specific policy and procedure related to this. Because that's really what's going to cover you. But it's important to be able to say, you got in a sterile field and you're clean, like we got to start over or something. So encourage you in clinical environment, if you ever see someone doing something sterile, watch. And don't just watch practically what they're doing with the patient, but watch what they touch, what they don't touch, the order in which they do things. So they open up the package clean, and then they take the sterile gloves out, but they only touch the top of the package and pinch it out. And then they put their sterile gloves on somewhere else, and then they come back, and then they can actually touch everything within the sterile package. And, or if you watch someone put on a sterile drape on themselves, how they do that, or how they put on a rhino kit, watching a physician do that's pretty cool. One of the things to keep in mind is that a non-sterile person shouldn't be within 12 inches of the sterile field. That was an interesting thing I learned. So really, really important, because if we break if we break aseptic technique, we're putting that patient at risk for infection. So it's really, it could not be more important. So that concludes episode 77, Evaluate Whether Aseptic Technique is Performed Correctly.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.